there, welcome back to another Eye Care for Your Brain with board-certified neuropsychologist Dr. Karen Sullivan. Tonight's topic is the brain science of melatonin. Melatonin is a neurohormone that is released into the body and circulated, penetrating every tissue in all living organisms in the entire animal kingdom. It is often called the hormone of darkness, and that is because melatonin is synthesized and secreted in the dark and suppressed by the light. We make very little to no melatonin for the first 3 months of our life. That is why babies are such terrible sleepers, usually initially. And then by 3 or 4 years old, we are producing as much as we ever will for our entire life. The problem really becomes midlife, age 55, when we start to progressively produce less and less and less, to the ages of 65 to 70, where we're producing well below 80 to 90% of what we did during the vast majority of our adult life. So most of us think of melatonin, rightfully so, as the master sleep hormone, and that is totally true. We're going to talk about that today. But many brain and aging focused researchers also feel that the drop in melatonin is the cause of many age-related conditions, including dementia, and directly related to changes in memory and posture and balance, which I think is new information for a lot of us. So one scientific paper about melatonin that I will link to in the comments here is titled Under Promises and Over Delivery. And I thought that that was so interesting. Its focus is on its very strong antioxidant properties. So tonight I'm going to try to teach you something about melatonin that maybe you have not heard before. So the information I'm sharing today is geared towards adults. I don't really talk about kid stuff that much. I'm not a pediatric provider. And remember that this is not personal advice. I am a neuropsychologist and do not prescribe any medication. So on the Eye Care for Your Brain channel, we often talk about sleep being foundational, paramount, so critical to health of all types, including brain health. So one of the questions I frequently get is, well, what do you think about melatonin? So I'm here to answer that question today. So at this point in the literature, I would say that there is sufficient evidence that low doses of exogenous melatonin, which is what you would take in a supplement pill form, have a positive impact on both sleep quantity, which is usually the way people think about it. They think it helps me get to sleep earlier, it helps me stay to sleep longer. But maybe even more important is the impact on sleep quality, and that is going to be part of our lecture tonight. So melatonin was first isolated as a supplement in 1960, and to get just a teeny tiny little microgram, they had to take it from 200,000 cows and the pineal gland in their brain, which is the primary producer of melatonin. So when you think about quantity, the effect of melatonin might not be as powerful as you think. So research suggests that it works better and more effectively in younger people, probably because they have a lot more receptors in their body and in their brain. But in folks over the age of 85, it increases total sleep time by only 12 minutes in the average person and only helps you get to sleep 4 minutes earlier. So it's actually not that effective as you might think. So basically, it buys the average person about 20 minutes worth of sleep, which if you were having a hard time sleeping, that might be worth it. But there is one group of people where it does work better, and these are people who have something called delayed sleep-wake phase disorder. So these are people who have trouble falling asleep at kind of what we would consider usual times. They don't really have that natural urge to go to sleep before 2 in the morning, and they would prefer to sleep until 10 or 1. And I'm going to tell you that I, for a very long time, was in this category. Melatonin supplements seem to help those of us who have that sleep difference in a much more significant way. So we can get up to 30 to 40 minutes more of sleep, be able to fall asleep at a more kind of regular predetermined time, and report better daytime functioning the next day with the use of melatonin. But I think the most meaningful impact of melatonin on sleep is actually how it affects sleep quality. So this is where we see the much bigger benefit to us in the brain health community. So we have good scientific evidence that melatonin is significantly more effective than placebo in significantly increasing the amount of REM sleep from the very first night and increasingly over a few weeks. Now, REM sleep, deep sleep, is critical to brain health and neuroplasticity. So one universal effect of really all types of brain health challenges is a disruption in the circadian rhythm. So think about anything from a traumatic brain injury to Alzheimer's disease, to Parkinson's disease, to depression, to post-traumatic stress disorder. The sleep-wake cycle is almost always disrupted. It's either too much sleep or not enough sleep or broken sleep architecture. So it's mostly written about in stroke recovery and all the different subtypes of dementia, how much sleep changes with these different conditions. So we often turn to an EEG, and what we see is that the 5 stages of sleep are not happening as they should. We're not staying in those stages long enough to get the benefit. So there's accumulating evidence that when we are in very specific sleep states that we have heightened plasticity in the brain. So basically, the process of brain recovery can happen a lot more deeply and a lot more effectively in the different phases of sleep. So we have some pretty compelling evidence that in things like stroke and TBI, we have sleep disorders becoming very common. So we have breathing disorders like sleep apnea, good old insomnia where you just can't fall asleep or you can't stay asleep, and we have restless leg syndrome. These are a lot more frequent in people who have a brain health diagnosis, and there's worse outcomes for these people in the short term, usually in terms of cognition and mood, but also long term when we think about what is the future for people who have these diagnoses. So I'm very happy to say right now, we're finally starting to see some large-scale studies for brain injured populations when they are in acute care. So what I mean by this is, how are we protecting sleep, knowing it's so important? How are we protecting it in hospitals, in nursing facilities, in rehabs? And they're doing this by adjusting lighting, by putting in noise machines to protect the sleep-wake rhythm. We are using sleep promoting drugs that are natural. We are starting to see melatonin, low-dose melatonin standardized. And we're also starting to see paying attention to the actual environment, because we know sleep equals brain health. The reason we are now pushing this as a scientific community is because we know in deep sleep that that plastic state is just so heightened. So part of that plastic state is a very deep process of cleaning that happens within both deep REM and also non-REM. So basically, the cerebral spinal fluid comes and washes over the brain in a more powerful way, pulling out things that shouldn't be there. Now, this can be anything from old blood products, if you've had a hemorrhage, all the way up to the plaques and tangles that can cause or worsen Alzheimer's disease. We also know that our immune system is really in full gear during REM sleep. So REM deprivation, in contrast, reduces the ability of the brain to do the deep cleaning process, and we see less brain cell growth, we see less regrowth, and we see less synaptic plasticity. And these are all things, so that's losing connections between brain cells. We don't want that, right? We don't want incomplete clearing, because when old blood products and toxic things can't get out, we are then in a state of chronic inflammation, which we know is either the cause or the exacerbator of so many different brain health challenges. Like I said before, that deep clean also includes the misfolded proteins that are at the heart of what Alzheimer's disease becomes. We know that the cutoff is about between 5 and 6 hours. So people that get under 5 hours are twice as likely to develop dementia when we compare it to people who get 6 to 8 hours. And our sleep quality in midlife, when it's poor, seems to kind of bite us in the butt in our 70s. So what you do in your 50s definitely goes on to matter for your brain health in your 70s. In the short term, when people get more REM, not only do they report being more alert cognitively during the day, medical providers who don't know what quality sleep their patients got consistently report patients who get more REM as being more higher functioning. They get better scores on a global impression scale. So I thought that was pretty interesting. Experimental and clinical studies in animals and humans suggest pretty strongly that healthy sleep promotes increased learning and memory in everyday life. So in the long term, we know that when people recover from brain injury of all kinds and they get higher quality sleep, that they get more return of function. And this is because that plasticity allows the reorganization of damaged brain networks. We also see a reduction in risk of most dementias with high quality sleep. And this is really due to not only the cleaning process, but two different compounds that are most effectively manufactured and released during deep sleep, which are nerve growth hormone, which is released by the pituitary gland in stages 3 and 4 in sleep. And we also see brain-derived neurotrophic factor. So what we want is maximum release of these things because they build and repair muscle, they build strong bones, and they repair tissue, including the brain. So both have a regenerative action on brand new brain cells and also brain cells that may be failing a little bit in terms of age or in terms of injury. So yes, melatonin, definitely the primary sleep hormone that provides regulation to our circadian rhythm, our sleep-wake cycle. But as I said before, it also has other health properties. So I want to briefly tell you about those now. You can really think of it as providing direct detoxification to the byproducts of cells. So every day when we're working hard, we have oxidative stress that is released. Kind of think of it like a smokestack coming from a fire. It's kind of the consequence of the work. The location of where we absorb melatonin is in the mitochondria. So you might remember that word from biology. That's really the powerhouse of the cell. So what we see is when there's more melatonin, everything in the biological system seems to just work better. We know that it has been effectively used to reduce inflammation and restore tissue function in a number of human trials. And it also can reduce some toxicity from some overuse of prescription drugs. And where we're most hopeful is that there's certainly some suggestion, I wouldn't say it's been proven, but some suggestion that it can delay and maybe even treat some age-related brain issues. So neuroprotection is another one of the properties of melatonin, and this is through its antioxidant power. We also know that it lowers blood pressure a little bit, which improves vascular function. So they've done trials in Parkinson's, Alzheimer's, brain swelling, depression, brain tumor, stroke, traumatic brain injury. When you look at the effect of melatonin, especially in an animal model, which allows you to look at it much in more depth, we see that an animal who's had an induced stroke, there is a reduction of the size and the impact of the stroke when they are also taking melatonin supplementation. So I had mentioned before too, it's not just kind of neurological things as we typically think of them. We also know that mood disorders are impacted by melatonin, and we kind of have a chicken or an egg question there. So if you think about any time in your life where you have struggled with mood, chances are your circadian rhythm was also messed up. So you either slept too much or you just could not get good quality rest. So I found some research for you on major depression and bipolar that I thought was interesting and seasonal affective. So in people with bipolar, we see a marked decrease in the secretion of melatonin when they are in the depressed stage, and when symptoms stabilize, we see that it gets restored back to normal. In folks with major depressive disorder, we see things like getting up too early in the morning, moodiness, trouble with being alert, feeling really fatigued, and this also correlates with disturbances in melatonin. And in people with seasonal affective, we see that during the winter season when they experience depression and the better mood in the summer, we also see that there's variations in melatonin by season. So if you are someone who's watching this because you have a sleep problem, I want to make sure you know what is the very worst thing to do for your sleep problem. The very worst thing to do is to take over-the-counter sleeping pills. These cause me great concern as a neuropsychologist because they increase the risk of dementia, and they contribute to memory decline. And this is because of their strong anticholinergic properties. So these are typically the ones that are sold over the counter. And anticholinergic medications are in a class of medications that block the neurotransmitter acetylcholine in the brain. Now, this is a chemical that we need for learning and memory. If you've ever heard of Aricept, the dementia medication, its job is to put more choline into the brain, more acetylcholine into the brain. So when we have anti-cholinergic properties, we're actually doing the opposite. So it's almost like a pro-dementia pill, and you do not want that. When taken over time, we see there's a very clear, what we call dose-dependent relationship. So the more you take, the worse your memory is, the higher your risk for dementia. And that is something that I want everyone out there to understand. So in contrast, what is evidence-based sleep medicine? Well, I can tell you the most important thing you're doing right now is to educate yourself and empower yourself with science-based information. And once you understand how critical good quality sleep quantity and quality is to brain health, and you understand how impactful it is, I think you're going to be motivated to follow through with science-based strategies. So the first thing you're going to do is understand what is sleep hygiene. So sleep hygiene is all the stuff you've probably heard before. Keep a regular routine, expose yourself to early morning sunlight, reduce exposure to strong light sources 1 to 2 hours before bed, especially devices, lower the temperature in your bedroom by a few degrees, use your bed for sleeping and intimacy only, develop a pre-sleep ritual to give your body and brain the signal, hey, we're shutting down, we're not engaging anymore, we're actually taking a step back, and we're going to work on calming so we can accept the state of sleep. We cannot force sleep, right? All we can do is to accept it. If these common sense things don't work, then what you want, and you're not getting 6 to 8 hours of sleep, and most importantly, you're not waking up feeling refreshed, it is time to consider supplementing with melatonin. Now, I'm going to tell you a little bit more about that this lecture and the next one, because I guarantee you've not really heard the right way to use it. But if supplementing with melatonin and 4 other evidence-based recommendations that I'm going to talk about don't work, then you want to consider a sleep study to diagnose any possible sleep disorders. So what I'm going to do next week is come back at you, and I'm going to have multiple recommendations for you. So this is something we've never done in the history of I Care for Your Brain, and something we have been asked for 5 years, but I finally decided to do it. I'm putting together a list of the top 5 sleep products that I believe are on the market today. And I'm going to have links on our website so you can go and get them yourself. And what we're going to do is use any of that money that we get from Amazon Marketplace. We are going to be donating a portion of it to the Neurological Alliance. This is absolutely one of my top favorite nonprofits. They're based in the UK, and what they do is they bring the agenda of 80 different brain health organizations together, and they really advocate for greater, quicker access to brain health experts and person-centered care. So together, you're going to get better sleep. We're going to help people in the brain health community, and we're going to help to support the cost of doing these lectures and offering what we do at I Care for Your Brain. So I'm going to tell you those 5 things that I'm going to be recommending, but I want you to tune in next time because I'm going to go into the science and I'm going to tell you what brands specifically. So these are evidence-based recommendations. This is objective. This is not any pressure to buy anything. This is, here's what I have bought for myself, and here's what I tell my patients. And I'm going to go through these in more detail next time. But the first thing is going to be a sleep watch to actually get data on what's going on with your sleep. I'm then going to talk about the power of a sleep mask. The third thing is a weighted blanket, which you probably never heard the formula for figuring out what weight you should use. I think that's really important. I'm going to tell you what natural foods contain melatonin at the highest doses so you can use them. And I'm going to be making a recommendation for a very specific melatonin supplement. Now, if you've been watching me for years, you know that I have been hesitant to get involved with recommending supplements because I have very specific and pretty high standards for what a company would need to be doing for me to be comfortable recommending it. And miracle of miracles, I do believe I have found that company, and we've been communicating back and forth to make sure that they meet my criteria. So briefly, I'm just going to tell you, it had to have third-party purity testing because especially with melatonin, I'll share this data with you next time, it's incredible how different the actual quantity and sometimes even the actual products, the ingredients that are in there that aren't labeled. So it needed to have third-party testing. It had to be backed by verifiable science that was published not just through the company's own agenda. Had to be free of any other additives. Lots of supplements actually have wheat, gluten, GMOs, binders, fillers, all that. Every ingredient has to be listed, even if it's in trace amount. It needed to be, this is very specific to melatonin, had to be offered at a dose that is scientifically supported. And the vast majority of melatonin out there is nowhere near the recommended dose that I tell my patients. And the final one, the company had to definitely make everything here in the USA and had to come with the support of a registered dietitian. So not just like giving you supplements and telling you to figure out, there had to actually be a number where you could communicate with a clinician. So what I'm going to do is be back with you next Tuesday with all of that information. But what I would love for you to do in the meantime is tell me a little bit about what you learned from this lecture. What surprised you the most about melatonin? Have you found a way to integrate it into your sleep routine? Has it helped you? Have you noticed any side effects? Has there been any drowsiness or kind of like a hangover effect the next day? That's almost always because the dosing is wrong. So please tune in next time. Please leave us a comment so other people can learn from you. And thank you so much. I hope that you are a subscriber to us at I Care for Your Brain and tune in once or twice a week for science-based brain health so you can be your own best advocate. Take care.